Understanding liver failure requires knowledge of its types, causes, and symptoms. Liver failure occurs when the liver loses its ability to perform essential functions. The liver is responsible for filtering toxins from the blood, producing bile for digestion, storing nutrients, creating proteins, and regulating blood sugar. There are two main types of liver failure. Acute liver failure develops rapidly, often within days or weeks, typically in individuals without pre-existing liver disease. Chronic liver failure develops gradually over months or years, usually due to long-term damage resulting in cirrhosis. Acute liver failure develops rapidly, often due to viral infections like hepatitis or drug-induced liver injury, particularly acetaminophen overdose. It typically occurs in individuals without previous liver problems. Common causes of liver damage leading to failure include viral hepatitis B and C, alcohol misuse, non-alcoholic fatty liver disease, also known as metabolic dysfunction-associated steatohepatitis, genetic conditions like Wilson's disease, autoimmune diseases, and issues affecting bile ducts or liver veins. The progression of liver damage typically involves four main stages: inflammation, fibrosis, cirrhosis, and ultimately end-stage liver disease. In the inflammation stage, liver cells become damaged and inflamed. This leads to fibrosis, where scar tissue begins to form. In cirrhosis, extensive scarring disrupts liver structure and function. Finally, end-stage liver disease represents complete liver failure. Symptoms of liver failure can include jaundice, which is yellowing of the skin and eyes, abdominal pain and swelling, ascites or fluid accumulation in the abdomen, nausea, vomiting, malaise, disorientation, sleepiness, and a characteristic musty breath. Ascites, or fluid buildup in the abdomen, is a common symptom of advanced liver failure. Chronic liver disease accounts for about 80% of all ascites cases. Diagnosing liver failure involves several tests. Blood tests measure liver enzymes, bilirubin levels, and coagulation factors. Imaging studies like ultrasound, CT, or MRI can assess liver structure. In some cases, a liver biopsy may be necessary to determine the extent and cause of liver damage. Blood tests include liver function tests that measure enzymes like ALT and AST, bilirubin levels, prothrombin time for clotting function, and albumin levels. Imaging options include ultrasound, CT scans, MRI, and specialized tests like transient elastography. A liver biopsy provides tissue for direct analysis, determining the extent of damage and helping identify the cause. Understanding the types, causes, and symptoms of liver failure is the first step toward effective management and treatment. The landscape of liver disease is evolving. While the burden from viral hepatitis is decreasing with widespread use of antiviral agents, metabolic-associated steatohepatitis is projected to increase due to rising rates of obesity and diabetes. Currently, there are no approved therapies for acute on chronic liver failure, and no candidates in late-stage development as of early 2025. Despite these challenges, the liver disease therapeutics market is experiencing strong growth, with projections reaching $15.23 billion by 2025. A key area of research focuses on liver fibrosis, the excessive accumulation of extracellular matrix proteins, including collagen. This process occurs as a result of chronic liver injury and inflammation. Various factors, including alcohol, hepatitis, metabolic disorders, and genetic factors, can lead to inflammation, cell death, and oxidative stress, which activate hepatic stellate cells. These activated cells can either progress to fibrosis or potentially regress through cell death or deactivation. Emerging treatments for liver failure include cell therapies using modified immune cells to repair damaged livers. Clinical trials are evaluating macrophage-based therapies that aim to reduce scarring and stimulate liver regeneration. Research initiatives are exploring combinatorial therapies for cirrhosis and acute on chronic liver failure, assessing treatments like human albumin and enoxaparin. Researchers continue to develop artificial liver assist devices to support liver function, potentially reducing or delaying the need for transplantation. Similarly, hepatocyte transplantation may temporarily delay the need for a full liver transplant. A major trend in liver failure management is the movement toward personalized medicine. Recent research explores predictive models for personalized prognosis in patients with acute on chronic liver failure. The future of liver failure management includes several promising developments. Advanced biologics and gene therapies are in early development phases, while researchers focus on creating non-invasive treatment options. There is significant investment in developing targeted therapies for liver fibrosis, which could prevent progression to end-stage liver disease. Telemedicine and remote monitoring are becoming increasingly important in managing liver disease, especially in underserved areas. Artificial intelligence is also being applied to improve diagnostics and treatment protocols. The field of liver failure treatment presents both significant challenges and promising opportunities. While metabolic liver disease cases are rising and approved therapies for acute on chronic liver failure remain absent, the growing therapeutic market and emerging technologies offer hope. Novel cell and gene therapies, combined with personalized medicine approaches, may transform the treatment landscape in the coming years, potentially reducing the need for transplantation and improving patient outcomes.